Cancer is a disease where cells in the body grow out of control. Thanks to advances in science and technology, we now know that changes in a cell's genetic material, its DNA, are often what drive this uncontrolled growth. These changes are called genetic mutations, and understanding them is key to both diagnosing and treating cancer. In this video, we'll explain how doctors can analyze a tumor's genetic profile through a process called next-generation sequencing, or NGS. We'll also cover how this information can be gathered from a tissue biopsy or a simple blood draw, known as a liquid biopsy. What is biomarker testing? There are a lot of terms used to describe this kind of testing: molecular testing, genomic testing, tumor genetic testing, somatic mutation testing, biomarker testing, and more. These can be confusing, especially when they're used interchangeably. For simplicity, we'll use the term biomarker testing to describe all of these types of tests. Biomarkers are genes, proteins, or other substances that can give important information about your cancer, what type it is, how it might behave, and how it may respond to treatment. Biomarker testing looks specifically at the genetic material of the tumor cells, not your inherited DNA. This is different from genetic testing, which checks for inherited changes that may increase a person's risk of developing cancer. How is cancer diagnosed, and what role does biomarker testing play? The first step in diagnosing cancer is usually a biopsy, taking a small sample of tissue from the area of concern. This sample is sent to the pathology lab, where a pathologist examines the cells under a microscope and uses special stains to determine what kind of cancer it is and where it came from. In the past, this information was often enough to guide treatment. But now, we've learned that looking deeper, down to the DNA level of the tumor cells, can help identify specific mutations or targets that allow doctors to personalize treatment using targeted therapies or immunotherapies. What is next-generation sequencing, or NGS? Next-generation sequencing is a modern method that allows scientists to look at many genes in a tumor all at once, quickly and efficiently. This process determines the exact sequence of DNA letters in a sample, essentially reading the genetic instructions of the cancer cells. Here's a basic overview of how it works. First, tumor tissue from a biopsy is processed in the lab. DNA, or RNA, is carefully extracted from the cancer cells. The sample is then placed into a sequencing machine that reads the DNA code. This code is analyzed to look for mutations, changes that may be driving the cancer. A report is then generated and sent to your doctor, typically within 1 to 3 weeks. This report helps your care team understand the biology of your cancer and identify possible treatment options based on the specific mutations found. This has helped improve cancer treatment. Biomarker testing and NGS have helped make personalized medicine possible, treatments tailored to the unique genetic makeup of a person's cancer. Here are a few examples of how this has improved outcomes. In non-small cell lung cancer, identifying mutations like EGFR, ALK, or ROS1 can lead to highly effective pill-based treatments called targeted therapies that often work better and have fewer side effects than traditional chemotherapy. In breast cancer, tumors that are HER2 positive can be treated with drugs that specifically target the HER2 protein. These therapies have dramatically improved survival for many patients. In melanoma, patients whose tumors have a BRAF mutation can receive targeted therapies that block that mutation and help slow or shrink the cancer. Thanks to these advances, patients with advanced cancers are now living longer and with a better quality of life than ever before. What about a liquid biopsy? In some cases, a biopsy of the tumor tissue may not be possible, or more information is needed. That's where a liquid biopsy comes in. A liquid biopsy is a simple blood draw that looks for cancer-related genetic material floating in the bloodstream. This material can come from circulating tumor cells, also called CTCs, which are whole cancer cells that have entered the blood. Or it can come from circulating tumor DNA, sometimes called ctDNA. These are tiny fragments of DNA that are released from tumor cells when they die. Even though a liquid biopsy doesn't test the tumor directly, it can still provide valuable genetic information using the same NGS technology. The results can help guide treatment decisions, especially if the tissue biopsy is unavailable or no longer reflects how the cancer is behaving. Liquid biopsies can also uncover new mutations that may explain why a patient's current treatment is no longer working, and they can help point doctors toward a different, more effective therapy. In summary, biomarker testing looks at the genetic makeup of your cancer to help guide treatment. Next-generation sequencing is the tool that reads the tumor's DNA. Testing can be done on tumor tissue, called a biopsy, or blood, called a liquid biopsy. This information helps your doctor choose the most effective, personalized treatment plan for you. If you or a loved one has cancer, talk to your care team about whether biomarker testing and NGS may be helpful in your care. These tools are helping transform cancer treatment, one patient at a time.